someone in the Q&A reminded. So yes.
Thank you very much. I'm sure that was one of our alumni who pay attention, I'm sure. Anyway, March for me is, so the 3 goals are 30, 30, 30. So it's a protein goal. Doesn't have to be all UNJURY protein, but sometimes using protein shakes does help get those, grams in. And the second goal is any exercise goal that you want. So depending on where you are in your exercise, it might be walking a half a block every day or every other day. It might be trying to get 10,000 steps in every day, whatever your goal. And it doesn't have to be walking. It could be going to gentle yoga, chair yoga a couple times a week, but you pick your exercise goal. It's just something to commit to for the month of March. And then the third one is to measure something that has nothing to do with the scale the whole month. It could be your blood pressure. It could be blood sugar. It could be a hip measure, like circumference measurement. It could be how many hours of sleep you're getting. It could be, help me out, Rachel, what else are we measuring? Stress. Stress was the other one.
Stress levels. Yep.
Yes. So just pick something that has nothing to do with the scale, but is a good measurement of, something that has to do with your health. And you'll keep track of that throughout the month. We provide a tracker. We provide options for an online tracker if you want that. The challenge is free. Everybody gets a t-shirt and you get a little gift of UNJURY protein. So that comes towards the end of the month, but you do have to sign up. So I'm going to have Rachel in whenever you're ready. But if you can find the link, Rachel, and put it in the chat, that would be great. So you can still sign up until I think the cutoff is noon tomorrow. Noon tomorrow, we're cutting off. So if you want to join, doesn't matter if you're pre-op or post-op, everybody can do it. You're welcome to join. That's March for me. But let's really quick, I want everybody to know a little bit about Laura's story before, even if we just take a couple minutes, and then I'm going to show you some before and after pictures, because like I said, she's killed it. I mean, she has literally killed it after surgery. Yeah. And I know a lot of people here are pre-op and, looking ahead. So hearing a story from somebody who has really done it all right is worth hearing.
Well, thank you, Christy, first off, and I'm so happy to be here. I'm Laura, and I had surgery. I had the modified duodenal switch December 28th of 2021. So I am just now 14 months post-op, and I've lost 235 pounds, which blows my mind. and to put it into kind of perspective, I'm only 5'1". So wow. I have a lot of extra weight on me. And yeah.
Look at all the hearts, Laura. Everybody's loving it.
I know. And today it's changed my life. I can't even put into words. It almost makes me want to cry, because the life I'm living now is not the life that I was living before. My weight held me back in every way you could ever imagine. And I don't think you realize until you're on the other side of it, how much it truly affects you. I did all the things that I was told to do. The plan is there for a reason. So follow your surgeon's guidelines.
Stephanie's loving that right now.
Yes, I know in the beginning, it's so hard because I always say this, I feel like you grieve the life that you had before. And those first couple months are so hard. But I promise you, if you stick to it, it becomes just every day, it becomes your new normal. And I can honestly say 14 months later, this is my new life. Protein, movement, water, I live by those still 14 months later. And I can't sing a bariatric surgery, the praises of it enough, because it's changed my life.
Amazing. Thank you so much. And I am going to show some pre and post-op pictures. For those of you who have not found Laura on Instagram, you'll see these kind of pictures there. But this is, let's see, share screen. This is what she's been up to. Are you guys seeing this? Pretty amazing.
It looks like a totally different person.
New person.
And that was actually 2 months post-op. So I'd already lost about 50-ish pounds. I can't remember.
Wow. Exactly. Wow. Yeah. Okay. Let me stop sharing this one. I'm going to share the other one. I love this one. You have Laura, you're one of, I think one of the things we're going to talk about tonight is just remembering to take pictures beforehand. And I see on your Instagram this picture in these PJs. And so I'm assuming like I think in a couple different places, and I'm assuming that you probably were the same. You didn't have a lot of those before pictures. And you know, people just forget to take them. Or maybe they, you know, they're the person we hear all the time. They're the person who decides to be the picture taker instead of being the one in the picture.
Yes, I had hardly any pictures from the last maybe 10 years. I actually just did a post on this the other day about really important life events that I wasn't in the pictures because I was so unhappy with the way I looked. But take the pictures, guys. You will be so happy.
Yeah, and it's so helpful too to be able to see your progress, because just I talk about this all the time. You know, we stand in the mirror as we're aging, and we don't necessarily see the wrinkles on a day-to-day basis. But if you compare, like, gosh, this is what I looked like when I was 25, and this is what I look like when I'm 40 something, you see then you can see it, right? And it's the same thing with weight loss. A lot of people don't feel all their progress until you're able to hold up those side-by-side pictures. So even though it might be painful, even though it might be really like, oh, I don't want to do this, do it, hide it, put it just somewhere just for you. It's worth it. So thank you for sharing. And we are going to ask you to, you know, share more as we go, but Stephanie's presentation is waiting for us. And there's some good stuff to learn from Stephanie. And then we'll ask Laura to pipe in as we go. I will also say two things. One, yes, we do give attendance receipts for coming to this meeting. They're emailed automatically. It takes about 3 to 5 days. I'm sorry, it's a kind of a lengthy process. So hang in there, wait for it, check your spam. It ends up most of the time in people's spam. It's an email that comes from UNJURY news, e-news at UNJURY, something like that. But look for that. Inside that email, there's the recording of this meeting, and there's your attendance receipt that you can send on to your clinic. If you have problems, email us at supportgroup@unjury.com and we will find it for you. Okay. What else? Oh, we're going to, at the end, if anybody wants more information about March for Me, stay on at the end. We also do a raffle prize right at the end of UNJURY goodies. So stay on for that. Everybody here is registered and can possibly win some prizes. So, all right, now I'm going to shut up. Stephanie, what do you have for us tonight?
Well, you know, it's hard to go after Laura because I mean, that's just so incredible. I have questions too I want to ask, but I will do my best to stay focused. We are going to talk about preparing for surgery. And so I am going to share my screen with you guys. I'm going to get this open. I think the screen is open now.
Yep, you're good.
And let me get this out of the way. So yeah, I'm going to be calling on you, Laura, because I'm very curious too. And I'm so happy to hear that you said stick to the plan. And yes, Christy, thank you for acknowledging that. Made me really happy because all of that information that is sent out to our patients or to any of you guys as you are embarking on the weight loss journey is meant for your well-being. It is meant for your care, and it has also taken patients' feedback and it has been crafted. So it really is a lot of information for your benefit. So absolutely, I'm so happy to hear you you followed it and stuck to the plan. Very happy and proud of you for that. As I said, we're going to talk about preparing for surgery, your body, your home, and your family and friends. And we're also going to talk about the actual surgery. We'll talk about that and then some tips on how to recover or some tips to think about for after surgery. So I actually want to hear from you, Laura. Is there anything you did to prepare before surgery, or did you kind of have the mindset of like, let me start after, you know, like once I have surgery and then focus on it?
So I was pretty fast paced because I was self-pay. My insurance didn't cover it. So my consult to surgery was just about a month.
Oh, wow.
Wow.
Yeah. So I didn't have much like preparation time. So I'm not like the best, like, of course I got some of the foods and stuff, you know, that I would need after, which I recommend not stocking up on a whole bunch of stuff because sometimes your taste buds change. But I did not really do much preparation.
Mm,
Okay,
yeah.
that's an unusual experience because I've only met a handful of people that have had to pay out of pocket
Mhm.
or didn't use insurance. And so, okay, so Laura's a little bit of a different example
Yes.
here. Most people have at least maybe say 3 months wait before they have surgery at a minimum. Again, that can vary before based on your insurance plan and your program and your health conditions. But there are a lot of things you can do before surgery to help you prepare for it. So some quick little small things you can do is start working on your diet, start making some small changes. They don't have to be giant overhauls. Fruits, vegetables, lean protein. Again, small things you can do that don't have to be drastic changes. Drink more water and or sugar-free fluids because your hydration, as Laura mentioned earlier, Christy and I talk about this all the time. Hydration is important. So if you're not really good about drinking water now, start thinking about it, practicing it, carrying a water bottle around with you, because that's actually really important. Track your food. I really recommend patients track. This also helps me as a provider because I look at people's food logs if they share them with me, and it helps me help them better. It helps me find out where to help them, where they're struggling. So I do think that's actually a really good tool to use. Other things you can do is start trying different activities like for physical activity movement. Yeah, MyFitnessPal, that's a great one. That's a good one you can use. Um, movement, try to find different things that you enjoy as far as like moving your body. It doesn't have to be structured exercise. It doesn't have to be in a gym. Uh, but there are so many different ways that you can move your body and get some of those health benefits from. And again, it could be even as simple as something inside your home, like marching in place. Um, and then the other thing I would say is maybe talk to your providers and discuss realistic expectations for your post-op journey. So, because they might have some things that they want to discuss with you. And some people, I do recommend some people work with a therapist to get additional support along the way throughout the weight loss journey because losing weight is not easy. It is not just as simple as food and that's it. It's a lot, and sometimes you just might need a little extra support along the way. And so sometimes I do recommend patients work with a therapist to have a little extra support, especially as they go into the bariatric surgery process.
Yeah, Stephanie, I love to say that people who are dealing with weight issues are often dealing with layers of things, and
Oh
not everybody
yeah.
has the same layers. And a lot of times, getting to the place where there's balance and there's comfort and there's sort of peace with everything is a matter of peeling back the layers one by one sometimes, and a therapist can help with that a lot.
Yeah, because unfortunately, and you guys, some of you may have experienced this already. Sometimes your provider visits are really short, and it's not that we want them to be that short. Like sometimes I have so many more things I want to talk about with the patient. We just don't have time. There's another person waiting, or that's just how the appointment was booked. And so, unfortunately, that's also why I say a therapist could be a great person because they have more time. And also too, there's a scope of practice where like there's things I can't talk about.
Yeah,
So
and I think Laura, you said something at the beginning that was really important, which was you do go through a grieving process. I've heard other people say this before, that there was this old life that had some wonderful parts of it too, but it's going to be different. It's
yeah,
sometimes how you celebrated with family or how you did social things with friends, and there is a little bit of a okay, I have to let go of that, or I have to say goodbye to that because this is the new person. So working through that, I don't know if you worked through it on your own or, but I would think
I
that that's some,
did.
yeah,
Oh, good.
Yeah.
Oh, look
good.
at that makes me
It's
happy.
possible. Yeah. But if you need help, I always speak of this. Get help. Like it is
Mhm.
okay.
Yeah. Yep.
Yeah. You know what? I forgot to say something. So I just want to say this is totally side comment. Victoria Ross is on the call. I saw her mention herself earlier, and
Mm.
she's joining us from the UK. So I just wanted to say that because I saw her put that in the comment earlier, and
Yay.
I just thought that was the coolest thing ever because I think that's probably the furthest.
We've got Canada and the UK. We actually had Australia once, or
Okay.
maybe a couple times. We did have Australia, but welcome.
Yeah.
Welcome, Victoria. And I think there may be a couple Canadians on tonight. So this is amazing. Are they yours, Laura? These are your
I
people?
don't know. I've had a couple people reach out today from the UK, so I don't know
Okay.
if they're from me, but I said it'll be recorded if you don't want to stay up late, and, or it might be the middle of the
Yes.
night. I don't know. Oh, she is. Yes.
Awesome. They're 5 hours ahead. What time is it right now? 7. So yeah, midnight. It's past midnight.
Wow.
Um, so sorry guys, I just had to say that because I thought that was really cool. Okay, so when it comes to your home, there's some things you can do to prepare your home. If you don't have smaller plates or utensils, you might want to go get some, like even like the little kitty plates and utensils. After surgery, it's an adjustment. And you'll learn quickly, like you are going to feel full very fast. So using a normal size plate is not going to be helpful. It's not going to be appropriate for you after surgery because it can be really hard to measure the appropriate serving size for you, what's going to be right for you with a large dinner plate. So a smaller size utensils and bowls and plates are actually going to be easier for you because we tend to want to fill up the space with our eyes, and so a larger plate is not going to be appropriate. So use smaller plates and utensils. Measuring cups and a food scale. I think these are great tools, and I always encourage people to have these in their homes. They help you take the guesswork out of like your portion sizes and how much protein is this that I'm eating and that. They really help you with taking the guesswork out of it and being a little bit more accurate and understanding your portion sizes.
Yeah,
I said,
Stephanie, I also always tell this story at this point. We had a guest on one time who didn't like tracking calories, who didn't I feel like some of the standard ways of tracking it just wasn't for her, but she was totally okay with weighing her food on a little plate or in a little cup that she used before she ate. So she would just weigh the whole thing. So she always had exactly 4 ounces of food. That was her way of tracking. She did amazing. But she would, do her protein, put some vegetables in and it was just always 4 ounces.
I love hearing how people get creative and
Yeah.
find ways that work for them. So if one thing doesn't work for you, that's okay. What does work for you? So I
Yes,
actually really
yes.
love that, Christy, because she took a problem and she approached it with like new perspective and a new solution. So
Yep.
yeah,
Yep.
I love that. What else can you do to prepare your home for surgery? What you see here on the screen, I like to say this, like I like to tell people have this before surgery. It's better to have these things and not need them than need them and not have them. So what do I mean by that? So absolutely you want to have some clear liquids. That's pretty simple, straightforward. You want to make sure you have your protein shakes right there right before you go into surgery, because you don't want to be in the hospital ordering your stuff because it's going to take a little while to get to you. So you want to have them in your home before you have surgery. You also want to have your vitamins there right before surgery. Again, you don't want to wait for them to get to your house because of shipping and stuff like that. Some of you might need a pill crusher. Not everybody's going to need one, but some people will still have to take certain medications after surgery and will need a pill crusher. So something to consider buying. Um, Gas X. Gas is common after surgery. It doesn't happen to everybody, but it could happen to you. So it's nice to have something like that in the house just in case, because you don't know if you're going to need it or not. Some type of laxative or stool softener, because constipation is common after surgery. And again, you want something if you need it versus, being uncomfortable and then having to run up the store and get it. So again, some things just to think about. And then this one is program dependent. Not every program recommends this, but our program does. We do recommend people have a bottle of Pedialyte in the home just in case they start to become dehydrated. So if your program doesn't want you to have it, that's fine. But sometimes programs do want patients to have that. Laura, anything you have that you think would be helpful for people to prepare for surgery?
Something that I used after surgery that my surgeon recommended was those little medicine cups, those 1 ounce,
Those are good.
1 ounce. Yes. And depending on how much, I can't remember exactly. I would divide out my protein shake and then the water. Like I think there were 5 of them per hour. And if you divided that up, it made it easy and like doable to get your protein and fluids in. So that worked for me.
Yeah, a little shot glass of protein when you really don't feel like eating anything is definitely more sort of, okay, I can get that down.
Yeah, I can do that. I can't
I
do
can
that
do
big old
that. Yeah.
thing. Yeah.
Absolutely.
So how else can we prepare for surgery? And Laura mentioned this earlier. I mentioned this earlier. You're going to get a binder or some kind of material, some kind of information from your program with a ton of information and instructions on your diet, medication, and what to do. Please follow that. Please read it at least once. If you know you're not going to read it, have someone else in the family read it so that, someone can kind of guide you and prep you through it. But it is really for your safety and your comfort, and it's really meant for you to have to be as prepared as possible, so please read through that. Before surgery too, you are going to have to arrange a ride home. Not all hospitals will allow you to drive yourself home. I know our hospital does not. We do not allow you to drive home, so we also don't allow people to take a taxi or an Uber, so we do actually require someone pick you up. I don't know how your program is, how your hospital is. That might be different, but that's a good question to ask. Do you need to ask someone to pick you up and take you home? Do they need to take some time off to do this? So that's something to think about. Make sure you plan to take time off for your procedure. Most jobs will ask that you give them a little bit of notice when you're requesting time off for something like this. Most people that I encounter take about 2 weeks off of work for their surgery and their healing time. Not everybody takes this much time off, but this is kind of the common amount of time that I see.
Yeah, I love when people say too, like there are a lot of people who do feel pretty good, like, hey, I'm working from home most of the time anyway, I can work. But the one thing that I've loved people saying, here is that they took time for themselves where they could really focus on their new routine,
Yeah.
making, the shakes, the protein thing, like getting used to that whole new life
Mhm.
before you put yourself back into maybe your work environment or, whatever environment that it is that definitely could be stressful, could take up a lot of your time. And, maybe it would be difficult to prep all your food ahead of time before you leave and, or, leave for work in the morning or whatever it is that your daily routine is. So it is kind of a gift of time for you to get used to
It can be
some of that new stuff.
overwhelming.
Mhm.
Yeah, it could be overwhelming. Again, like you're taking a shake, a liquid, a medication, and so it can be overwhelming. And then if you jump back into work right away, it can feel like a lot. So yeah,
And you might not feel that great, right? Like you take some
no.
vitamins and protein and not a lot of other food, your energy is going to be pretty low. And then you show up in the break room and somebody's got birthday cake or something ridiculous. I mean,
Yeah,
there's a
you're
lot that
absolutely
could
right.
disrupt those first couple of weeks. And Laura, we're going to get to sort of, well, actually it's in this asking for help, but you have four children?
I do. Yes. All
Wow.
under the age of 9.
Okay, so
Oh
did
my
you have
gosh.
help with
I did. My
okay.
husband works at home and my parents came in. So
Oh, nice.
honestly, I feel like the surgery is the easiest part. Like Christy hit it with it's adjusting to like your new
Mhm.
life after
Yeah.
that really is what is so hard.
Yeah.
Yeah.
Yeah, I see a bunch of people in the chat. Thanks for sharing, guys. I see 5 weeks, 3 weeks, 2 weeks, 4 weeks. So yeah, like it seems like majority of people take a little bit of time to adjust,
Mhm.
which is
It's
good.
smart. It's smart.
Yeah.
Yeah. And if you don't have that much time, but you can negotiate maybe part-time for a couple of weeks, like working until noon or something where it's just not, you're giving yourself the time to plan and prep and have your food ready for you. I think that's, and just the time to feel good.
Yeah. So right before surgery, we talked about this briefly, and I'll just kind of like chime in on one more point of view. We did talk about taking photos before surgery, and it can be uncomfortable. Some people just don't want to. Remember, these are private. You do not have to show anybody. If you want to, absolutely go ahead. But if you do not want to, do not show anybody. That is your privacy. But I do encourage you to do it in your own, like, in your own locked files, because sometimes I see patients after surgery and they have a plateau. Plateaus are normal, they happen. And then they might feel like frustrated. I'm putting in all this work, I'm exercising, blah, blah, blah. The weight's coming off so slowly. But if you look at photos or we're taking inches, there is progress still being made. The numbers are not changing drastically, but there is visible difference and like changes in inches. The number on the scale doesn't always reflect the changes. And that's the other reason why I tell people, uh, take photos. They can be private. You don't have to show, but I am a fan of photos. Um, and then ask for help. So Laura has help. She had help with her family. If you can ask for help, please do. Don't do this alone if you don't have to, because it is a lot already to take in. It can be overwhelming. You might need help with groceries. You might need help with childcare or like yard work or whatever, pet care. So, again, if you don't have to do this alone, don't do it. Ask for help. It's okay. People do want to help you. They just usually don't know how. So vocalize what you need. And then, your help might not be even like something physical. It might just be like you want support, in which case, invite your family or your friend to one of the support groups, and that way they can hear the information for themselves. So that's also another way of asking for help.
Yeah, I think people often prefer to be told what is helpful than trying to guess. A lot of times if
Yeah.
somebody's sick or has a death in the family or anything where you might want to give help and you say, well, just let me know what I can do. Those people are never going to tell you what you can do for them. But
Yeah.
if that person said, you know what, if you could just pick up my son from daycare for me today, that would change my life. So tell people what they could do to help you, and also be really honest about the things that, if it's your family and you tend to do a lot of like family parties or family get-togethers, I think it's probably helpful to say, hey, look, I'm not going to be able to, I love everything that you cook. I'm not going to be able to have it. So just be prepared for a little
Yeah.
while. I'm going to be bringing my own shakes with me. I'm going to be, I'm going to eat before I come, just so I don't have to worry about it. And did you have any of those conversations, Laura, with family or kind of friends ahead of time about what was happening, or did you kind of just keep it private?
Oh no, I've been completely public the entire time. And that has helped me though. And
Yeah.
I've had nothing. I know not everyone has this, amazing support, and
Hmm.
I'm so sorry. But everyone has been so supportive and they just knew.
Yeah.
I will say I did have friends like bring meals for my
Hmm.
family.
Yeah.
So like my husband didn't have to cook, or I didn't have to cook anything, and he didn't have to cook. And that was really helpful. So yes, like what you said, you can ask for, and when people offer, like it's okay to accept the help,
Mhm.
because they wouldn't offer if they didn't want to help.
I think
Yeah.
we've talked about this before, Christy, how like sometimes it's hard to like ask for help or accept it.
Hmm.
So yeah, I totally agree with that.
Especially so many patients that we have talked to have been the caregivers for their entire families
Mm-hmm,
or for
hmm.
their elderly
Yeah.
parents, or for, whatever the case is. They're used to being caretakers and they're really good at it. And that's just their comfort zone. And trying to sit back and let other people take care of them you know, it's really hard, but it's okay to be taken care of a little bit.
Absolutely. Um, okay, so what other things can you guys do to prepare for surgery? So right before surgery, like the day or two before surgery, you need to pack a bag because you have to get ready for surgery. You're going to be in the hospital. Your overnight bag should include ID, a change of clothes, some non-slip shoes or slippers, toiletries, especially if you have sensitive skin or you just like your products, then take some of your toiletries. It does get really cold in the hospital, so you might feel like you might get chapped lips, so maybe some lip balm. Do you wear glasses or dentures? You want to think about a case or something to keep them in. uh, Everybody's going to be in the hospital for a different amount of time, and that's just because of their own monitoring, and just it's not an exact science for each person. So with that being said, you might need a phone charger. So bring a phone charger, put that in your bag. And then you might need to bring a CPAP, like some of you are on a CPAP. So your nurse will tell you if you need to bring that to the hospital or not. But that is something you guys do need to talk about before you have surgery. And so, Laura, anything that you would recommend, anything that you took for surgery that you would suggest?
That's pretty much exactly what I took. You do not need much at all.
Okay.
Hmm.
And I didn't even, I waited. I was discharged that next morning, first thing. So I showered at home, because a shower
Mm,
at home is so much better
you feel
than the
comfortable. Yeah.
hospital.
Yeah.
Yeah.
No, you go ahead.
Oh, I was going to say, I've heard two other things, and I don't know if all hospitals would allow this, but I've heard sometimes bring your own pillow if you're
Mhm.
one of those people. who, and we all know some of us are just really specific pillow people. And then the other one is possibly bring your own bathrobe. Because you're not, if you're in the hospital for 2 days, let's say, or 3 days, because you just have a more difficult procedure or things, don't go quite as smoothly afterwards, you might be there. You're going to be walking the halls and, they're going to try to get you moving a little bit. So if you have your own bathrobe and you can put it on if they let you, but I would ask that one ahead of time if you can bring a bathrobe.
Yeah, that's a good one. I also saw in the comments there were headphones, eye mask, and an extension cord. That's actually not a bad idea.
Oh, a crochet
Or like
project. We're getting all
crochet
sorts of,
project. Yeah,
yeah,
some good ideas.
all sorts of
Uh,
ideas. Good.
but on the flip side, I have one person, Mary, who said she had the classic DS and she was in at 5 a.m. and out at 5 p.m. So everybody's different.
Wow.
That's insane. That's
That's
awesome.
insane. Yeah,
Yeah,
that's great.
but
Congrats.
everybody's different. And so I can't actually say how many days you're going to be there. Just there's so many variables why that could affect how long you're staying there. So
Yeah.
just in case, have a bag. Again, it's one of those things you'd rather have it and not need it than need it and not have it. So
Yeah. And there are some very, very simple things that, not terrible complications, but just things that they might want to monitor for an extra day or something. So
yeah.
it doesn't mean things went poorly. It just means they want to keep you for another 24 hours.
Safety. Yeah,
Yeah.
exactly. Regardless of what you do or do not put in your bag, or I should say, regardless of what you put in your bag, do not put anything that you value in
Mhm.
there. Because when you go to the hospital for your surgery, you are not going to stay in one room. You are going to move around a lot. Like they're going to check you in, they're going to like work you up, then you're going to go to surgery. There's going to be a room you're going to be in afterwards where they monitor you, and then you're going to go to the floor if you go to the floor at all. So because of that, there's a lot of opportunity for things to get lost or misplaced. So don't bring anything that is valuable to you that you would be upset about if it happened to get lost. And then of course, follow right before surgery, the 1 to 2 days before surgery, follow the instructions that your providers have laid out for you, whether that is for your pre-op diet, liquids, timing of your medication liquids, anything like that. Make sure you follow their instructions as they are written because they were meant for your safety as you go into the procedure. Now, when it comes to the actual procedure, so as we've kind of said, and like I've seen in the chat, there's the amount of time you stay in the hospital is so different. On average, it's about 1 to 3 days in the hospital, and that's because your doctor is monitoring and he's determining when it's like the best time for you to go home. Some people go home really quickly. Some people it's just like checking, just making sure we just take a little bit of extra time, just checking over you, making sure everything's okay. So because of that, on average, we just say 1 to 3 days in the hospital. While you're in the hospital, you will receive IV fluids. So you won't be, we don't push fluids on you as much orally, but you have the IV fluids going. You will be given some pain medication to help you manage the discomfort. This also varies from person to person, facility to facility. Some people, the high pain tolerance, some people low pain tolerance. In general, you'll be comfortable. But again, you'll be given something. You're going to be asked to walk. So please walk, okay? You might be tired, and I understand. But the reason why we ask you to walk after surgery is one, it helps with getting your bowels moving. Number two, most importantly, it helps to get your blood flow. The reason for that is because it is to help to prevent the risk of developing blood clots. So please, if they ask you to walk, please do your best to walk. If you feel like unstable or you feel like really, really like tired to the point where like you might faint, don't. That's a safety issue. But otherwise, understand that we're asking you to walk for your benefit. Some of you might have to wear like little like compression garments on your legs. Again, that is also for prevention of blood clots. So again, some things to keep in mind when it comes to your experience in the hospital. So some things to remember, you can start prepping for surgery now. Don't wait. There's actually quite a bit of things you can do leading up to surgery. Decide who is going to be on this journey with you and what conversations, if any, you need to have with them before surgery. What kind of ways can you ask them for help if you need help? Again, those are the types of things you want to think about before surgery. 2 weeks before surgery, you can start thinking about how to prepare your house, what products to buy and stock, and then start thinking about your aftercare. 2 days before surgery, let's start planning and like packing your little overnight bag. Let's follow the instructions for your program for what to do leading into surgery. And then, of course, take photos. You don't have to, but we do recommend that, or suggest that, I should say.
Mhm.
Okay, so now when it comes to life after surgery, you will get a lot of information from your program on what to do and what not to do. But we'll cover some tips on like recovery and supplements and some side effects. Okay, so like we mentioned, after surgery, your surgeon, like, so the way it actually works is your surgeon is going to decide when it's safe for you to go home. uh, when you are ready to leave the facility, they are also going to give you another little packet of paper of information, some like, last minute to-dos and instructions. Please read them, please follow them, because again, they are intended for your safety and for your comfort. You should plan on taking it a little easy for a while after surgery. The time varies from person to person, but understand it's normal to be tired after surgery because your body is recovering from a big surgery. These surgeries are so common now that we don't really think of them as big surgeries, but they're still big surgeries. We've just gotten better and better and better about doing them. But regardless, your body is recovering from a surgery, and that can result in you feeling tired, understandably. Um, Also, after surgery, your calorie intake is drastically reduced. That could cause you to feel tired. So just understand that some fatigue after surgery is actually normal. Do the best you can and just be patient. But again, do plan on taking it a little easy after surgery. Um, oh, go ahead, Kirsty. Were you going to
I
say
was just
something?
going to say, Laura, did you like in your plan? I loved that you said you had these 5 little like 1 ounce cups sort of set up and ready to go to get. Did you have a schedule set out for yourself that was like, okay, I do 5 shakes and then I get my water in and then I do a
Yes.
5-minute walk and then you had that whole thing
So
planned out.
my surgeon gave us, it's like way back on the very beginning of my feed. It was like a printout
Okay.
and it had how many like protein shots we needed to do, how many water shots. And then next to that, I put my W for walk and then the incentive spirometer too. So then
Oh, right. I forgot about
I
that.
don't
Yeah.
remember how frequently it was, every 15 minutes or something.
Mm,
I think the walking was only once an hour. They recommended making sure to walk like 5 minutes once an hour while
okay.
you're awake.
Okay.
But that really worked to like keep me on track for
Yeah.
the beginning.
Yeah. That's nice that they laid that out for you. Do you guys do
Mhm.
that at your program, Stephanie?
So ours, we do, it's a little different. It's not quite as like small volume, but we do have like little schedules broken down, like suggested schedules for them to
Mm-hmm.
follow. Some people do follow them, not everybody does.
Mm-hmm.
But the other thing I was going to say is, Laura, I do get the sense that you must also be a very structured person by nature. Like that must be your, okay. So because again, we do have that, Christy. We do have schedules, and we
Uh-huh.
even have it for first week, the second week, with the different diet changes and the way
Mm,
we suggested ways to take vitamins. But um, not everybody follows them because not everybody wants to be that structured, or they really are trying. And then just the appetite is just so different
Mhm.
afterwards that they're like, I can't, I'm struggling.
mm,
So
mhm.
there's a little bit of, variability in that.
Yeah. Everybody has to find their own way to do it. If you try to do Laura's way or you try to do exactly whatever is on the piece of paper and it's not working for you, then that's not good either. You have to find what works for you.
Yeah, because then you also don't want to push it because you're also adjusting this tiny little pouch and it feels weird. And I'm just going to call out Peggy's comment in the chat. She said, I did terrible after surgery just because she, probably felt tired. And
Mhm.
yeah, like there's a lot of changes after surgery. So it's understandable. Everybody's going to kind of do the best they can. We do give schedules. Um, is it easy to follow? No, it's okay. You just keep trying. And when you get a little bit further, it gets easier.
Mhm.
Further out from surgery, it gets easier.
Yep.
Um, but like I said, I can tell that Laura must be a structured person. So,
I
and that's
am, and
not a
I'm a
bad thing.
rule follower too.
That is not a bad
Tell me to
thing.
do it, I'm gonna do it.
I love
I
it.
love it.
Yeah, you're an easy patient. I can already tell. Um,
Were you a
uh,
first child, Laura?
I am.
Yes,
See?
it's a first
There's proof
child
of
thing.
that. Now ask about my brother, who's the third. It would be a completely different story.
Yes, yes. I have, as my own children, I have a 20, almost 20-year-old, and then an 18-year-old. My 20-year-old is the super rule follower, and my son is I just do it my own way.
Yep.
It's so hard to believe that you have a child that old, Christy. You don't look like
I
you
know.
are like you,
Very
compliments
kind
to
of
you, because I'm
you.
like, you don't, it's crazy to think your child is that you
Very
have someone
kind of
old
you.
enough.
I get a lot of protein, Stephanie.
Oh, see, thank you guys. We're in the right place. You know what?
Yeah,
Anne also said she's the oldest child, and she says she's a total a
total
rule
rule
breaker.
follower.
I thought
Rule
she was gonna say
breaker.
Somebody said
okay,
rule
okay.
Oh,
breaker. Yeah.
I was expecting to say follower, but anyways, okay. So, everybody's different. You just find what works for you.
Yeah.
It's not easy. We get it. But anyways, follow your instructions as best as you can. Avoid heavy lifting. So your providers aren't going to want you to lift anything heavy for the first couple weeks after surgery. And that's because we want to make sure we protect you and that you don't put any pressure on the your surgical site. And then please walk after surgery. You don't have to be, super aggressive in the beginning. Gradually build up to it after surgery, eventually to a goal of 30 grams, 30 minutes per day or more. Again, work your way up to that. And then, do what you can. This will all get better and easier with time. So some things to think about after surgery. Now, this is my favorite, but Christy, I think you do a better job at describing, at saying the PVWW. So would you mind? Oh, wait, you're muted.
Yeah, this is one of my favorites. PV dub dub, protein, vitamins, water, walking. I don't know where it came from, but we were saying it so often one night that I was like, we need to like tattoo it across our foreheads as the thing. And actually, Laura, with zero prompting, you actually said this at the beginning.
Yeah, that was
Or pretty close to it anyway.
Yeah.
But yeah, we lean into this pretty heavily, that if there's anything that you're going to focus on in those first, I mean, forever, but in those first several weeks to months after surgery, think about this.
Yeah, these are essential. If nothing else, I agree with Christy. Just think of these four things: protein, vitamins, water, walking. I don't say it as fast as well as she does, but so I'll say it slowly. But use protein, UNJURY protein shakes and soups to help you meet your daily protein goals after surgery. Remember to sip on your fluids throughout the day. We want to prevent dehydration. That is super important. You don't feel good when you're dehydrated. It's not fun. So we want to prevent that. So also you want to take your vitamins after surgery. It's not, if you guys were here for our last session, it's not a temporary thing. It's for the rest of your life. So protein, vitamins, water, and then walking. So walking is actually a great activity that helps to get the blood flowing, but can also help you along with managing and maintaining your weight after bariatric surgery. So protein, vitamins, water, walking. Some quick little recipe ideas, and these are from the UNJURY website, so feel free to take a look. But this one is really easy. This is high protein, low calorie Jello, sugar-free Jello. Jello technically counts towards your liquids. This can be used at any point of your post-op journey, early or like 5, 10, 15 years out. It's nice to have a little texture, like a different texture, especially early post-op, because you get kind of tired of burnt out of liquids. So it's kind of nice to have like a different mouth feel, a texture when you're early post-op. And then later post-op, it's refreshing, and it's also nice to have like as a dessert when you're, down the road, or even for like holidays, you want to bring your own treat. So again, this one's pretty easy. It is sugar-free Jello and UNJURY protein powder, unflavored. This is also another easy one. This is also low calorie, high protein. It is the 2 scoops of UNJURY vanilla protein powder. It is skim milk, blend everything together, a little packet of sugar-free pudding, a little thicker consistency, ice trays, freeze them, and then you have like a little refreshing popsicle that you can sip on that's high protein. This is also kind of good too when you're like kind of feeling a little nauseous and you just want to sip on something to like kind of settle your stomach, but you want something more than just like liquids. This has a little bit of protein in there, and it's kind of it's just a soothing to so you get the like cold texture, and you don't feel like you have to actually eat a meal. So a little something to consider. Also too, it's good, just a nice little high protein dessert, for later down the road when it's not winter. So just a little something to consider. Some side effects after surgery that you may experience. You might experience some sore throat. You might experience some soreness around the incision. You might experience some gas. Gas can be the result of drinking from a straw. Air gets pushed into your tiny little pouch, or from chewing gum. The same thing happens. It could also be from lactose containing products, which is why we really try to have patients kind of have lactose-free products after surgery. A lot of patients become lactose intolerant after surgery. So you may experience gas as a result, and that, it could happen to you. Fatigue, we talked about that earlier. You may experience some fatigue after surgery from the calorie restricted diet, from the surgery, from medications. You could be dehydrated. So different reasons why you may experience fatigue after surgery. Again, you might not experience any of these. Everybody's different. And I say that because everybody's experience after surgery during the recovery process is going to be totally different. I already had someone in the chat say they had so much energy after surgery. And then I've had patients come out of surgery saying they felt like they got hit by a bus. So, and then I've had everything in between. So just understand, excuse me, guys, just understand that the healing process after surgery is very individualized. And you may experience some of these things, you might not. Some potential complications after surgery that you may experience: dehydration. We talk about this again, remember the PVWW. Water. Okay, so dehydration is one of the most common reasons for readmission to the hospital after surgery. It's preventable, but it's also not fun. Like, you don't feel good when you're dehydrated. It can also contribute to constipation, which is also not fun. So please do your best to sip on your fluids throughout the day. It's a marathon, it's not a race. And we don't expect you to be perfect, but do try to just be mindful about sipping throughout the day. If you're someone that does better with a schedule, stick to a schedule. If you just are a visual person and you have to have your water bottle next to you to see how much has been drank throughout the day, then do that. But whatever it works for you, just try to be mindful about getting that fluid in throughout the day.
I want to make one quick comment, Stephanie,
Sure.
because I'm struggling. There's so much happening in the chat, and I think there are some questions. If your question went by and didn't get answered, so sorry. I usually tell people at the beginning, use the Q&A to put your questions in. We'll do our best to answer them, but you can also send questions to supportgroup@unjury.com afterwards, and we'll do our best to get to those too. So I'm so sorry if there are things that I've missed in the chat.
Sorry, guys. Yeah, I'm trying to keep up with it too. So constipation, very, very common after surgery. Most programs have like a little protocol in that patient Bible that they give you. So make sure you at least go through that Bible once before or right after surgery. And again, they usually have something about constipation in there, about like what they recommend you should do, like your steps should be. Just understand constipation is very common. Drink your fluids, and then eat fiber. And even then, that might not be enough. And so you might need a little extra support, a little extra help. So check in your book for what your program recommends. And if it's not in there, just ask the nurse what you should do, what they recommend you do. Nausea, vomiting, chest pain. This can be the side effect of eating too quickly, or too much. After surgery, it's hard to really gauge your new hunger fullness cues. And literally, it could be the difference between one bite, you're totally fine, one bite, it's way too much, and you're uncomfortable. So you have to chew slowly after surgery and take your time so that you don't make yourself feel uncomfortable. Um, the other thing is, and I did see a comment about dumping syndrome, so I want to cover this really quickly because I know I'm kind of getting at the top of the hour. Dumping syndrome may or may not happen to you. It is a potential side effect after bariatric surgery. It's and it so what it is it's unpleasant side effects after eating a food that is high in sugar. Sometimes it's from eating a food that's high in fat, but typically it's a food high in sugar. What happens is it moves very quickly into your small intestines. When that happens, it draws fluid into your intestines, and it can result in uncomfortable side effects like nausea, vomiting, diarrhea, rapid heartbeat, fatigue, weakness, sweating, uncomfortable. So again, Sometimes, so this could happen to you, it might not happen to you. The other thing about dumping syndrome is that it could happen really quickly, like 10 to 30 minutes after having this item, or up to 3 hours after eating this item. Um, but not everybody experiences it, and your program is going to give you like more information on like what to steer clear of. Typically, these types of foods that can cause dumping syndrome are also the same ones that can cause weight gain. So that's also something to think about. If you experience any of these symptoms, try to think back to what you ate most recently and write it down so you can start to track what the problem food is for you. So that's pretty much it for dumping syndrome. Some tips for success: sip your fluids. Again, we're going to say this again because it's really important. Fluids, drink them throughout the day, very important. Always keep your UNJURY protein shakes ready to go. Avoid bread, rice, pasta, tortillas for a couple weeks after surgery. They get doughy and sticky, and most people don't tolerate them right away after surgery. So you want to bring those in last. Your program will,
And for weight loss, it's probably best to keep them out for even longer.
for yeah.
What were your rules on these things, Laura? Do you take them in small amounts now, or do you still avoid them?
I pretty
No.
much avoid all bread, rice, and pasta. My surgeon's guidelines, I want to say it's up until the first 6 months, like everything's supposed to be less than 5, like less than 5 sugar, less than 5 carbs, less than 5 fat. My program's pretty strict with it. Things vary so much across the board, but I keep my carbs pretty low.
Yeah.
Yeah.
I think once they come back in, it's a little bit of a slippery slope. So if you can find alternatives for as long as possible, I think it's a very positive thing for weight loss.
I honestly don't even miss them now. I think carbs and sugar are just one of those things. The more you eat them, the more you want them. And like, I don't even want them now. So I've found good substitutes for them and it works for me. So
yeah, perfect. Sorry for the interruption, Stephanie, but I do think it's one of like the biggest questions, like, can I have it again ever? When can I have it again? How much can I have it again? So probably, oh yeah, Stephanie, absolutely. I know you had to pop off, and we're doing a little bit of a transfer of power here. So you all have to bear with me for like the last 2 slides. So Stephanie, are you saying your goodbyes now or in a minute?
I am so sorry. Yeah, I am gonna run, you guys. I am so sorry. There is another little meeting that I'm gonna jump on to. But it was a pleasure meeting you, Laura. Thank you for sharing all your information and your wisdom. Thank you guys for having me as always. I hope all of you guys have a wonderful week. Thanks for being here tonight with us with us at the Bariatric Academy. And again, Chrissy, thank you again for having me.
Absolutely. Talk to you later, Stephanie.
Bye,
And
everyone.
you guys
Bye,
hang in there with
Stephanie.
me for
Bye,
like
Rachel.
2 more slides. We're really close.
Sorry, guys.
Lots of love coming for you, Stephanie.
Thanks, guys. Have a good one.
All right. I think, you've got the slide
Yeah,
presentation
I know. That's
up.
why I was like, I'm
crap.
sorry.
Okay. I'm gonna talk through the rest. There's support and
this basically support in life after surgery.
Yeah. So
sorry, guys. I really hate to do this to you all.
All right, I'm going to do this without slides, but these are 2 sort of last slides that we want to talk through. And so one of the other things about life after surgery and things, and Laura, you're going to really help me out here, is that people do experience some hair loss, and it's normal, and it scares people, but it's also something that is a result of sometimes just the surgery itself, sort of the shock of the surgery itself, and some people say maybe the anesthesia. It also could be a result of some hormonal changes that are happening after surgery. And depending on how good people are at getting their protein and vitamins regularly, that can definitely help to at least limit some of the hair loss that you may experience. So tell me, Laura, what you've experienced.
I did experience hair loss, thinning, mostly like in this front area where you notice it the most. Started for me at about 4 months post-op, and it was pretty bad. And I didn't realize that it would bother me as much as it did. You know, you hear hair loss and you're like, but it can be very emotional. But For me, it's got better. Like it's not really falling out anymore. I'm 14 months post-op and it's coming back. Like I have tons of little baby
Baby
hairs.
hairs. Yeah.
So hang in there. I mean, protein, I did all the things. I bought serums, I bought shampoos. I don't know that they really work.
Yeah.
You just kind of got to let it run its course and
Yeah. Yeah.
it's back.
Yeah, we did have, there's a friend of ours who comes on, Felisa, and she does one of these meetings with us. And she said it was the thing that held her back from having surgery for 10 years. She loved her hair and she was so scared of it thinning or going away. It was like her feature. And she said she started doing her vitamins pre-op because her surgeon said, hey, make sure, like if there's one thing you can do for yourself, it's definitely take your vitamins every day and you know, get your protein. So she started doing all of that preoperatively, and postoperatively she said her hair actually grew. Now that's not, I can't say that's the reason, but she was just an anomaly. And she was like, I can't believe I waited 10 years to have this surgery because I was so scared about my hair, and I actually have better hair afterwards.
It's honestly one of
So,
the top questions I get too. People about
yes,
loose skin and hair loss are like
loose skin and hair
the top
loss.
thing.
Yes.
And but it's different for everyone. Some people, like you said, don't really experience it, and then other people do. So who knows?
Yeah.
Don't let it
Yeah.
hold you back.
Don't let it hold you back. Everything else is
Yes.
so good.
Yeah.
Second question here, because this is another big one, is weight loss plateaus. Again, normal. Everybody is not, you don't lose weight in a straight line. No matter how perfect you are, you're going to kind of boom, 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 boom down. And it's painful, especially after surgery. You think, gosh, this should just roll right off of me. And it should, if you're following, you know, the guidelines really, really well. It is going to feel, I say like melting. Some people describe it literally like melting when it's going well, but there will be times when it's going to stop. What did you experience, Laura?
I didn't have a ton of stalls, but I did. And really the first one that really sticks out in my head is like 1 to 2 months. I think you start introducing foods and you've already lost some weight, like quite a bit of weight normally. And that was really hard because I mean, you feel like you have surgery and you should just wake up and like
It's gone.
sounds lighter. And I get questions about stalls all the time. There's no magic fix. Like just keep doing it, consistency, and the scale will move.
Yeah.
I don't have like
And
any tips.
no, and I think sometimes, you know, when you hit those stalls, and Rachel, you may have an opinion on this too. Both Rachel and I did a lot of work with medical weight loss patients before coming to UNJURY. And the things that I would often tell those patients when we would hit a stall is your body's figured you out a little bit, right? Like you did this thing, and now you got to a place where your body's kind of figured you out. So if you can just trick your body by changing one teeny tiny little thing, even if it's just the time of day that maybe you're doing certain things, if you've been a really regular walker, maybe try riding a stationary bike. If you've tried, but just trick your body a tiny bit. Rachel, is that kind of your experience?
Absolutely. I 100% agree. And I always tell people change one thing and don't give
Yes.
it 2 days.
Yeah.
Typically, I would tell my clients, give it 1 to 2 weeks. And if that wasn't the thing, let's change one more thing. And it's the same thing. It's if you're normally cardio, do a little bit of lifting, or if you are, I eat these 2 vegetables and incorporate a different vegetable. It could be something really simple, but your body does really learn how to adjust to what you're doing to it.
Yeah, yeah. We're at 8:02, so I'm going to do, let's see, we talked about excess skin. This is not really the meeting for that, but I will tell you that in 2 or 3 weeks, we have a plastic surgeon coming on to the lifelong support group. If excess skin is one of the things you're most worried about, he's a Brigham and Women Harvard surgeon, and he's done 2 meetings for us before. He's wonderful. Pay attention to the support group meetings because he comes on and he talks about all the stuff related to plastic surgery, if you should have it, what might be covered by insurance, all that stuff. Exercise, obviously, we know we've talked a little bit about walking, and exercise is going to be a really important part of your post-surgery, both just feeling healthy, feeling stronger, but also your long-term weight maintenance. Remember that you're going to get to a point where there aren't probably any more food or diet changes that you could make. but you can always increase activity, change activity. Like Rachel said, you can start lifting weights, you can do other things without having to change calories anymore. So having an exercise routine is going to be important. Most practices do tell you to avoid alcohol for at least the first year. We do another whole meeting on how much alcohol is too much, and whether or not you should consider even trying to have a sip of wine ever again. That's a big question, but one that you should really talk to your practice about, because everybody feels a little bit different about it, and it's probably going to be different based on your own personal history as well. So we're not going to touch that tonight since we're right at the end. The only other thing I will tell you is just a reminder that support is so important. Whether it's in a group like this, we love having you all. We love, kind of connecting and offering each other support and, high fives. Take your pictures so that you can do things like Laura, which is help support other people by being an inspiration. Laura is in it. How many people are you an inspiration to, Laura, on Instagram?
Oh my gosh, almost 106,000 people.
106,000 people are following what she's doing. And
but
you don't have to.
So good for me too. Like the person, it inspires me every day and keeps me going.
Yeah, absolutely. So this is the point where I think you put it in there already, but just remind everybody how they can find you.
I'm on Instagram. I will put it down here because it's kind of weird.
Okay.
It's Sushi It Away. I would love to have you join us. And yeah, it's so fun.
It is fun. I follow along and get to see all the cool stuff. So it's, yeah, definitely follow Laura on Instagram. And so we do encourage you, if you're part of this group, wonderful. On the in-between weeks, in between days, you can join the UNJURY Cares Facebook group. We are also on Instagram as well, but we're not as fun as Laura on Instagram. So, so join us on. Yes.
If you have a hard time finding Laura, she's in our story. So if you go to UNJURY,
Yes.
that's a really easy way to find her.
Yeah, I know, because my name is not the easiest. I did never intend to have this Instagram. So
I know when someone asked earlier, I had to look at it a couple of times.
I know.
Yeah, you noticed that I introduced you as Laura because I actually wasn't really sure how you pronounce it. So good. Okay, so let's stay in touch, everybody, and do join us. Next week, we have an exercise physiologist / PhD dietitian from Emory who is joining us to talk about protein, metabolism, muscle, how to boost your metabolism after surgery, and he's amazing. So do come on next week if you want to learn about metabolism. After that, I can't remember what comes next.
A drawing.
What is it? Oh, we got to do the drawing. Yes, thank you.
Yes.
We've got to do our register. 6, the bariatric pyramid. We're going to talk about all the other things other than food that contribute to success. So sleep, stress management, exercise, support, all those things. And also anybody who wants to stay on after we do the drawing, I will stay on and answer questions about March for Me if you're interested in joining. So let me really quick tell you who the winner of the UNJURY prize basket is tonight. And then I will also answer questions about attendance receipts for anybody who might have missed it. Okay, Holly Stern, you are the winner of the UNJURY prize basket tonight. You just need to let us know that you're still out here. So either say in the chat, I'm here, or raise your hand, use the little raise your hand feature.
There she is.
Is she still here?
Yep.
Congrats. Congratulations. You'll get a bunch of UNJURY protein packets to try. You just need to send us your mailing address so we know where to send it to. So email us at supportgroup@unjury.com, supportgroup@unjury.com. All right, that was fast and furious, Laura. 8:07.
Such an amazing thing that you guys are doing.
Oh, thank you so much. It's a wonderful group. There is no more supportive group anywhere out there, I swear, than this group. They cheer each other on, and it's really awesome. So we hope you'll come back someday and join us again.
I would love to.
We'll do a whole nother topic because I have a feeling that people have a lot more questions for you.
I'm sure. But thank you so much for having me. I really enjoyed it.
Absolutely.
It was nice to meet you.
Nice to meet you too.
All right, we do a quick hug, everybody. This is our virtual hug for saying goodnight. So hugs to everybody out there. And I will stay on. So anybody who wants March for Me or attendance information, stay on. Rachel, Laura, have a great night, and
Okay.
we'll talk soon.
Bye. Talk soon.
All right.
You good, Christy? Do you need
I'm
me
good.
anymore?
No,
Okay.
I'm good. Have a good
Good
night,
night,
Rachel.
everyone.
All right. For anybody who is still on that didn't hear the March for Me information at the beginning, we do a challenge every year in March called March for Me. It's free. Everybody gets a free t-shirt and some free UNJURY protein. So it's fun to join. If you go to UNJURY Cares, if you go to our website and look at the most recent blog posts, you'll be able to find the link to join. I'll in fact, let me see if I can put it up here for you really quick. But the challenge is 3 things for the month of March. Oh, thank you, Mary Rowe, for putting that up there for me. Mary just put the link for registering. You only have until noon tomorrow to register, because really the challenge started today. But you'll pick 3 things to do for the month of March. One of them is a protein goal. So we're asking you to try to hit 30, 30, 30 through the month of March every day. So 30 grams of protein 3 times a day. The second one is an exercise goal of your choice. So anything that you want to do that is perfect for where you are in your journey. It might be walking a half a block. It might be walking 10,000 steps every day. It might be riding a stationary bike for 5 minutes. Whatever exercise thing is your thing that you can do. I can't get into my email. I tried for 2 days, but I registered. Don't know if it took. Melissa, you can always reach out to me and I'll check on it for you tomorrow. So just email Christy@UNJURY and say, can you check for me? And it's Christy with a K, Kristie @UNJURY. Oh, Denise, sorry. Let's see. And then the third goal. So we had the protein goal, the exercise goal. The third goal is a non-scale thing that is good for your health and you're going to measure. You might just write down your blood pressure every day. You might write down your blood sugar. You might say how many hours you slept every night. You might write down your stress level every day. So just kind of on a 1 to 5, after work or something like that at the end of the day. Today was terrible. I had a 5, or I had almost no stress today. It was a 1. But measure something that is not related to your scale, but still is a measure of how are things going. So that's March for Me. If you have questions about March for Me, put them in the Q&A and I'll try to answer them. But for anybody who's staying on to ask about attendance receipts, we do send them automatically. If you're logged in tonight, Zoom knows you're here and it knows how long you were here, and we'll get a report. We send an email in about 3 to 5 days that says, thank you for attending. Inside that email, it will say how long you were on and thanks for joining us. And then you can forward that on to your clinic. So look for an email that says thank you and attendance, or thank you for joining and your attendance receipt, something like that. Check your spam. It's often there. Good night, Mary. Let me see if there are any questions in the Q&A that I can answer. Let's see, substitute vitamins, do you get back on track? So there are some other questions. Is the speaker from Emory? If Rhiannon is on, yes, Emory in Atlanta. It's Zach Grunwald, Dr. Zach Grunwald. If you're still on, you probably know him. The recording is inside that email that we send. So the email is going to have 2 things. It's going to have your attendance receipt and it's going to have the meeting recording. We don't recommend vitamin patches simply because there's really no good research that says that most vitamins are actually well absorbed through the skin. There are a couple, I think maybe, I don't even want to say it out loud, but I think it's vitamin D that maybe has a tiny bit of research. But we don't recommend vitamin patches for bariatric patients. Whoever asked that question. Good. All right, everybody. I think if there aren't any more questions about March for Me or how to get your attendance receipt, then I think we're going to call it for a night. So thank you everybody who came and stayed on, and we hope you come back next week. And thanks especially for any of you who are still on that may be overseas somewhere or are staying up really, really late to be with me. So have a great night and work your March for Me. It's going to be a good month. All right. Have a good night, everybody.